So I see you worked at Sandbox. Is that, from what I recall, it's kind of a unique investment shop that also incorporates specific expertise in certain areas that they then impart on their kind of portfolio companies or partnerships. Is that kind of accurate?
Yeah. Sandbox it's a venture capital firm that really focuses on building funds around strategic LPs. And so I worked at the Blue Venture Fund at Sandbox, which is a collaboration with the Blue Cross Blue Shield Association, and then also at this point, almost every Blue Cross Blue Shield plan across the country is a participant as well. And so we were really focused on identifying, big problems in healthcare and then innovative solutions that were aligned to quality and aligned to cost efficiency and value. So
Mhm.
that was part of the impetus for identifying, what we ended up building here at Positive Development.
What drew you in particular to autism?
So my family's had a lot of challenges just broadly in mental health. And I think like a lot of folks there, I've come to appreciate that there's some neurodivergence mixed in there as well. And so when I joined Sandbox, it was really cool. They're like, "Hey, we touch all parts of healthcare. What do you want to work on?" And I said, "I'd love to work on behavioral health because of the personal connection and just, yeah, I'd say probably personal connection, the fact that I think it is one of, if not the most broken parts of healthcare. And then, like, what is more fascinating than better understanding the human brain and neurology and again, one of the most powerful but least understood parts of healthcare. So uh, I dug in and was working with some of our existing portfolio companies that were pioneering, different types of like virtual mental health. Able to was one of those that I worked really closely with. Um, but just came to appreciate the increasing prevalence rate of autism and the really high expense of the support options that are out there, namely applied behavior analysis, and just felt like this was really not meeting the needs of all kids. It's a spectrum, right? Autism is a spectrum. It's diverse by definition. And yet, like, really the only support option was like this one incredibly expensive intervention. So it felt like A, it's not meeting everybody's needs, but B, it's so expensive. If we're trying to, put all children into this one intervention, it's going to bankrupt us. And then I think what really got me excited was learning about the perspectives of autistic people themselves and how they were advocating for different options. And then it just so happened that my now co-founder, John, is and was the president of the Blue Venture Fund. And he shared his personal experience that, his son was diagnosed as a toddler and that they tried a whole bunch of options and then ultimately found a developmental therapy option that was just transformative for them and their family. And so I was really touched by their story. It just resonated with me, sort of the having grown up with autistic people and neurodivergent people. It just intuitively connected with my understanding of kind of their experience and what the kind of support that they might benefit from most. And so I just was captivated. And so that started a chain reaction that led to positive development.
So what was the first kind of problem that you started to tackle when you started positive development?
Yeah. So every I think one of the most core problems is that there's just because of the increase in prevalence rate, the increase in the number of families that are pursuing services, there's way more families that are looking for help than there are um, sort of affordable options for them to tap into. So that access challenge is number one. And then I'd say that the second and third right behind them challenges are, finding a high quality option that really fits your child is often a huge challenge. And so that was a big opportunity. And then the third piece I would say is just from a health economics policy perspective, the options out there were really expensive, like unsustainably so. So that was sort of the main challenges I saw when we were looking at positive development of what we could solve. The idea would be there's actually an opportunity for us to provide more affordable options because kind of the core problem here, right, is all support is expensive. It's if it's not funded in one way or another by a school system or the um, health insurance, and so ultimately a family is going to default to what's covered and affordable. And so the issue was that there were sort of only one intervention that was very high cost that was covered. So we identified, hey, if states and if health insurers looked at the research and updated some of their coverage policies, they could actually cover more options for families, some of which might be a much better fit for a large proportion of children on the spectrum and their families, and that they just so happen to also be more cost effective. So it's sort of like I've said sometimes it's like imagine if your health plan only covered the branded drug, but there was a generic available. It's sort of like that. Except in this case, it's actually a different and potentially more effective option for a lot of the families.
Hmm. So fast forwarding to today, through your platform and presence in the market, I guess you provide that access to families, and then tell us about the types of maybe programs you have that fit better with each particular case.
Yeah, so we offer our comprehensive model is really our core offering. It is a combination of speech, mental health, and occupational therapy that is all delivered within one overarching developmental framework, our developmental approach. And that is a lower intensity solution. Um, so it happens to be more like 6 to 7 hours per week versus a ABA program that's generally more like 20 to 40 hours a week. And so that level of intensity often just fits a family better, fits a child better. It's really focused on the strengths of the child and how do we build on what they find naturally interesting and where their natural curiosity focuses. How do we use that to then build on those interests, help them develop the skills to navigate the world as a neurodivergent person, and also build relationships with both neurodivergent people and neurotypical people. Because ultimately, a core part of our model is that relationships, the ability to build relationships, is sort of like a scalable way for all people to ultimately kind of navigate the world and solve problems and then, ultimately build love and relationships, which is quality of life and what we're all looking for. So we focus on those things. And then the final difference, I'd say, the final thing that we do really intentionally is that we try to bring the whole family into what we're doing. So as much as a family is willing, we want them to participate so that they can understand what we're working on and incorporate some of these really fun. I mean, that's a big part of it. What we do is fun. It's playful. It's something that's easily sort of incorporated into a playtime that you hopefully have with your child anyway. And so, how do we teach parents, siblings, grandparents what we're working on so that it sort of amplifies what we do outside of therapy?
Hmm. And is this kind of model delivered virtually, in person, combination?
Ultimately, since we're so sort of focused on relationships and social communication, our preference when we're working directly with a child is for that to be in person. Although we
Hmm.
do supplement with virtual therapy where convenient and necessary as a supplement. We, like I mentioned, we do a lot of family engagement and parent support. often we do that if the child isn't present, we do that component virtually because parents just find it more convenient. Um, if you're just meeting with one of our therapists as a parent to do that through telehealth.
And then can you tell us about the company today, kind of the scale that you're currently at? And then from there, I'd just like to hear about like, maybe a little bit about what you feel like is the constraint, like how you could scale faster.
Yeah, we are in 7 states in the District of Columbia, and we serve over 1,000 families. We're the largest provider nationally of developmental therapy. So if you focus on providers that work within our model, we're the largest one across the country. Um, the biggest constraint that we have, I think when we started the company, it was sort of getting health insurance or state Medicaid to cover this. That has rapidly evolved, which is really incredible. But to the point where now multiple states cover this via Medicaid. Some of the largest insurers in the country now cover our model as well. So our biggest roadblock is right now it's staffing. So it's just can we recruit and then train up staff fast enough while kind of balancing meeting the number of families that are actively waiting for our services. We've got a significant wait list at this point. So what we're really trying to do is ensure we find that balance between serving those families as fast as we can, but also making sure that everybody is, trained to the right quality standard. So that's our biggest bottleneck. I think, as we continue to grow in that capacity, health insurance coverages will maybe also, become eventually another opportunity for us to grow faster as well. But that's sort of our current situation.
Tell us a little bit about kind of the value that your investors have brought to the table aside from the financial capital.
We have investors that, for instance, like Flare Capital, where they have a high number of strategic LPs and have been really helpful in using those connections within those strategic LPs to open up doors for us with health insurers or hospital systems that might be referral partners, et cetera. Um, uh, we also have, all the sort of platform capabilities that they all bring, whether it be, talent related or, um, operating, past experts in scaling high growth organizations that we can tap into. But I think the main thing that they provide is just, a lot of conviction in what we're doing and, you know, uh, uh, sort of like that long-term view about what we're trying to build and what the right pace is to build that.
Mhm. Last two questions. One is, can you tell us about a person who has had a profound influence on you?
Yeah. I'll say my grandmother. Um, She was so I was lucky. My grandparents lived. I grew up in Virginia. My grandparents were right across the river in um, the District of Columbia, and so I would go spend every Saturday with my mom eating lunch with my grandma and grandpa. And I didn't know this until I was probably in middle school, but my grandmother was schizophrenic. And so I spent all this time with my grandma and then had this giant revelation from my mom that my grandmother had just a really, really tough experience navigating like life as a schizophrenic person in the 50s, 60s, and 70s. Uh, really difficult. And my grandma was the kind of person that, like, when she eventually ended up going to a nursing home, was just like the favorite of all the staff. Like she would sing all the time. She was just brought this really positive disposition, and I always admired that she went through so much, whether it was electroshock therapy or institutionalization for long periods, and still kind of like brought that positivity to life. So when I think about like what I get really excited about is like my grandmother basically lived through the one flew over the cuckoo's nest experience, you know. That wasn't that long ago. That's how we thought about treating people with severe mental illness. And I know for a fact, we all know that a lot of the people in those facilities were autistic back then as well.
Mhm.
So I just have a ton of empathy for and a lot of humility about what we know and what we don't know. And that we don't know a lot more than we know. And so we need to listen to those patients and their lived experience and treat them with a lot of, humanity. Um, and so that's what I get excited about. That's why my grandma's had such a big influence is like, I want to fight for people like her.